Blood-borne pathogens. Preventing disease transmission. Universal precautions. Babcock Center policies and procedures. Who is covered by this regulation? Employees of healthcare facilities, employees of clinics, factories, schools, jails, emergency personnel, emergency medical personnel, Babcock Center employees. Why take this training? It is a federal requirement for all staff to be in-serviced yearly. It provides directions for reducing disease transmission. Preventing disease transmission. How do infections occur? Infections occur when germs get into the body. There are several disease-causing agents: viruses, bacteria, fungi, protozoa, rickettsia, parasitic worms. The body's natural defenses: the immune system, which include white blood cells and antibodies. How do pathogens enter the body? Direct contact, indirect contact, airborne, vector-borne. How do I know if I have a true exposure or infection? You must have a pathogen or a germ. You must have a quantity. You must have an entry site. You must be susceptible. What are some diseases that cause concern? Herpes, meningitis, tuberculosis, hepatitis, HIV/AIDS, and SARS. What can I do to protect myself? Immunizations. Get immunizations. Check with your doctor about boosters. Check with your company about immunizations. Universal precautions. Personal hygiene, personal protective equipment, engineer and work practice controls, equipment cleaning and disinfecting. Personal hygiene. Wash hands, proper grooming, keep cuts covered, get regular checkups. Protective equipment. Gloves, gowns, masks, protective eyewear, exposure control kit, MSDS book, or material safety data sheets. Engineering and work practice controls. Watch for sharp objects. Removed soiled clothing. Change gloves after use. Wash hands completely and often. Label soiled object. Equipment cleaning and defecting. Clean all surfaces. Replace any equipment. Use a quarter cup of bleach to a gallon of water. And label all biohazard materials. When do I use these precautions? All the time. What do I do if I have an exposure? Take immediate action. Wash the area. Report the incident to your supervisor. Fill a report out immediately Get follow-up treatment as prescribed. What does Babcock Center have to provide? Any protective clothing that is related to my specific job. Any protective equipment that is related to my specific job. What does Babcock Center have to provide? Immunizations related to the job at no cost to you. You must accept or decline the hepatitis shot series and must sign a statement of your intent. If you accept, you will be given a first shot before starting, the second shot 1 month after you start, and the third shot 6 months after the second shot. What does Babcock Center have to provide? Provide medical attention if you are hurt on the job or you have an exposure due to a work-related accident. Code word: keep safe. Let's stay safe and healthy. Test: true or false? Universal precautions must be used at all times. 2. Gloves can be used over and over. 3. Personal protective equipment must be provided by Babcock Center. 4. You should pick up broken glass with your gloves. 5. Any employee who decides not to take the hepatitis B vaccine must sign a waiver. 6. The material safety data sheet should be locked up at all times. 7. Gloves must be changed each time between tasks. 8. I have to buy my own protective clothing. 9. I should treat all blood and or body fluids as potentially infectious. 10. I should always wash my hands.